How you doing? This is Pat from Suarez Physical Therapy again with Dan from CDSF. This is our episode 2 from PT to the gym. Today we're going to be talking a little bit more about the rotator cuff. Our last episode talked more about the shoulder blade and the scapular muscles. This time we're going to focus a little bit more on the rotator cuff. So what you see here is Dan's kind of set up in our typical banded external rotation for our posterior rotator cuff exercises. So as he's set up here, we've got a cone, bring him a little bit out, take a little bit of stress off the rotator cuff. What he wants to do is gently engage that shoulder blade as he rotates out. So this is one of your typical rotator cuff exercises, right? So from here, after Dan does a couple reps, he's working on, he's got his hand in the front, making sure his core is engaged, he's not extending at his rib cage, and he'll rotate. As he rotates here, he's thinking about just spinning that ball through the socket. So the progression from here, Dan will come up to a 45 degrees. So he's going to turn his body 45 degrees and get his arm 45 degrees here. Same thing. He's going to bring that shoulder blade gently back, and we're going to rotate, externally rotate from this position. So he's going to go again. And what you notice is he's rotating from that shoulder again. We want to try to avoid packing down with your lat. So Dan, if you could pack down with your lat to show what that feels like, or show what that looks like. So you see as he gets a downward slope in his shoulder now, his lat is really firing. So now he's trying to hold on to his scapula and try and rotate his shoulder with his lat. So we want to relax there. Good. We want to make sure his shoulder blade is engaged, and we're just rotating from that top. And our last progression here is to face that 90-90 progression, and you're going to rotate up. Now Dan's tall and I'm short, so an easy way is to get him to put his elbow on my shoulder and rotate from there. And from here, I can really feel if he's turning that lat on or not, or if he's just using that rotator cuff or that posterior shoulder. Perfect.
This is Mike from Capital District Sport and Fitness. I'm here with Pat from Suarez Physical Therapy. And Pat just talked about some rehab exercises that he'll do for the shoulder joint and the rotator cuff. And what you have to understand is just because you're rehabbing a specific injury or pain that you're having doesn't mean that you still can't train in the gym. You just have to be smart and make some slight modifications to exercises that you're already doing. So today we're going to go over some modifications we can make to both pressing and rowing exercises. So a lot of these cues will work whether you're dumbbell bench pressing, whether you're doing push-ups or cable pressing, any horizontal press exercise. Today we're going to use the dumbbell bench as that variation and go over some modifications you can make to allow your injury to heal, to still rehab, and to stay pain-free. So we're going to do the dumbbell bench press, and Pat's going to start and press both dumbbells up. Now the first change we're going to make is going from this pronated grip, where when you're here, that space where the rotator cuff tendons pass through is kind of closed down and becomes smaller. And to open up that space, we're going to swivel your palms so that they face each other. This is called a neutral grip. So we're going to modify to neutral grip. That's step number 1. The second step is looking at where your elbows are during the lift. So Pat's going to lower down right now. And the big thing that we want is where Pat's at, that our elbows are at 45 degrees and they're just meeting the line of your body. And that's going to take some stress off of the front of the shoulder as well, and we'll press up. What we don't want to do, and Pat's going to show us here, is allow the elbows to dive below your body as you lower down. So going really low, where the dumbbells actually touch your chest, we have some more stress in the front of the shoulder, so we'll press up. So from here, the big changes we want: neutral grip, the palms face each other, that the elbows are at 45 degrees, or not up at 90 or super tight, and that your elbows just meet the line of your body while you're pressing. Making those modifications should allow the rotator cuff to still heal, take stress off of the shoulder, while still training your chest and triceps and getting those training effects for your upper body that you want. And the modification we're going to talk about right now is to a chest-supported row, and a lot of these cues can go towards any of your rowing exercises to be able to slightly modify them to help relieve some of your symptoms from your shoulder and allow you to continue progressing with your physical therapy. So for the chest-supported row, Pat's going to go through a rep right now. We're going to talk about 2 changes we're going to make. The first is making sure that we don't start too rounded with the upper back or with a forward head, meaning your head's diving down towards the floor. So to correct out of that, Pat's going to come a little bit taller with the chest and think about making a double chin. And that is going to open up some of the space in the front of your shoulder to allow you to perform the exercise correctly and pain-free. From here, the second change we're going to make is instead of having a pronated grip or the palms down, we're going to go with a neutral grip. And Pat's going to show you swiveling the palms so they face each other. The same deal, that's just going to open up some of that space in the front of the shoulder where the rotator cuff tendons pass through. From here, we're going to go through our rep and think about squeezing the shoulder blades together as you drive the elbows back and then controlling down. Just like a lot of our pressing, you want the elbows to be at 45 degrees So they're not way up at 90 or way tucked into your side. And you're maintaining that tall chest and double chin throughout. And making sure through here too, if you hold at the top, that you're really feeling engagement and work through the back of the shoulders. So again, 3 changes we'll make to these. It's correcting that forward head and roundedness. It's then swiveling the palms so you're in a neutral grip where they face each other, and then making sure when you squeeze, you feel and have good engagement through the back of the shoulders.
All right, this is Pat again with Suarez Physical Therapy, here with Mike. So what we're gonna do is we're gonna go through a couple more external rotation posterior cuff exercises that we see in physical therapy. And then we're gonna have Dan transition you into the gym. All right, so I'm gonna have Mike lie down on his left side. So another one we like to do in PT is side lying external rotation. Again, we use the cones here, get that to get that humerus away from the body a little bit to reduce the stress. So we're gonna have Mike engage that shoulder blade slightly. So we're here, and then all he's gonna do is keep in a fist, he's gonna rotate that arm up towards the ceiling. We're going for as far as he can. He's just trying to engage, hold at the top for a second, and then he's gonna work his way back down. All right, and what I like to do from this position is I like to then give him some manual resistance. So what he's gonna do is he's gonna rotate up, I'm gonna give him a little resistance against, and then we're gonna bring him back down and we're gonna go again. All right, this way I can kind of grade how much resistance he's getting, so I can challenge him when he needs to be challenged, and I can challenge him through the whole range of motion. All right, and then from here we like to progress to a plyometric version. So I'm actually gonna take the cones out for this one, and I'm gonna give Mike a medicine ball. He's gonna go into that externally rotated position. He's actually gonna drop the ball and then try and catch it quick. So here we're working on concentric and eccentric, so the ability to slow his arm down as he comes forward. Still trying to maintain that shoulder blade engagement as he's dropping. So this is another advanced one we like for the posterior rotator cuff. Now from here, Dan is gonna take you through how they would transition some of these things back into the gym.
Right, so we're gonna have Mike get down into a side plank position here. We're gonna go and use the side lying external rotation again, but in a side plank position. We're getting a little more core work in here. Abs are doing some good work. From here, same cues Pat used, right? That humerus is just gonna swivel right in the socket. Mike's gonna externally rotate back towards me. Shoulder blade working. We're not over engaging the lats here. What I don't want to see is him trying to gain extra range of motion by just cranking his elbow back, or also extending his wrist. Good. From there, good. We're going to grab a band in the front here. All right, Mike's going to, so a couple things we can do from this position. We're going to maintain this side plank position. We can do another external rotation variation where we're using the band. Again, that humerus is just rotating in a socket. Or we can switch to a side plank row. So Mike's going to reach out, get a good reach, and he's going to pull back. We're going to keep a good 45-degree angle with that elbow again. Going back, pulling the shoulder blade towards the middle of the back. Good. What I don't want to see is as he reaches forward, he loses position with his upper back. A couple of things can happen too, is the head of that humerus can also push out in the bottom shoulder. So we got to make sure that we're staying tall through here. Good 45-degree pull, squeezing that shoulder blade towards the middle of the back.
All right, and the last one we're going to show you today from a physical therapy standpoint is rhythmic stabilization. So while your rotator cuff does help you rotate your shoulder, it also helps keep the ball in the socket. And so what we're going to do here is called rhythmic stabilization. So having Dan with his arm up, he's going to engage that shoulder blade a little bit. And all I want him to do is hold his arm here as I try and hit it in different directions. Now the idea is to not let him know which direction we're going and to change up my speed so that his rotator cuff has to react to stabilize his humeral head. All right? And I like working at 90 degrees and then bring it up overhead. And I like working a little bit higher up. Okay? So all I'm doing is batting around his arm. It's very hard for them to keep it in place, and that's the idea. They have to be able to react, and their rotator cuff has to be able to react to stabilize their shoulder. Now the hard part is when you transition back to the gym, you don't have somebody to do that for you. So what Dan's going to show us is how do we transition that back to some exercises at the gym.
Right, so we're going to go into a pressing variation with a kettlebell. So we're going to do a bottoms-up kettlebell pressing variation. So we're going to do a half kneeling bottoms-up kettlebell press here. So Pat's in a good position, right, 90 degrees with the legs. So we're going to press from that bottoms-up position, so you're going to squeeze that kettlebell as hard as you can. So we're really getting a lot of stabilization work in here based on how the kettlebell is situated in your hand. So he's gonna press back up, come on right back down. He's gonna hold here. What we don't wanna do is let that kettlebell start sinking all the way back in. Then we're just gonna get some more of that humeral, anterior humeral glide. So we want a good position, with a little bit of space, and he's gonna press that straight up. Good. Bring it back down and hold. And another way we can progress this, once you've mastered this half kneeling bottoms up press, is we're gonna go into a bottoms up press to a waiter's walk. So Pat's gonna go ahead and press that up overhead, hold it right there. And from here, Pat's gonna bring that other leg up, squeeze butt. We can go hand to the ribs, make sure that our abs are working, our ribs are in a good position, and we can go on a nice stroll here with the bottoms up waiter's walk.
Thanks for watching episode 2 of PT to the Gym with Capital District Sport and Fitness and Suarez Physical Therapy. And remember, it's not always just clear-cut steps. I'm doing my PT and then I'm doing my gym exercises. It all works on a spectrum, and you can make your progress with your physical therapy and progress those exercises and start to become more pain-free and work on those more isolated movements, but while also getting the training effects that you want in the gym by making smart modifications like we did today. So remember, when it comes to the shoulder joint and the rotator cuff, always get assessed, find a local PT who can look at you and figure out kind of what step of healing that you're in and how to help you progress your exercises and get you back to where you want, and then be able to make smart modifications in the gym to keep you pain-free. So when it comes to the shoulder, remember, make sure you have good, clean ball and socket rotation and that your cuff is strong enough to handle what you want to do. Make sure that humeral head can stay stable in the socket during all of your activities, and then build strength in those good positions.